Now we're looking at several issues hogging the headlines in the country, and we go live to our Abuja studios where an anti-corruption activist and the founder Follow the Money, Mr. Hamzat Lawal, joins us live. A pleasure having you on the program.
Thank you for having me.
Let's look at one of the hot topics at the moment. What's your view on the PIB and the Electoral Amendment Bill at the National Assembly?
I think our lawmakers need to rally around each other and unite for the purpose of Nigeria. Let's put Nigeria forward before anything else. On the PIB, let's stick to 5%. But most importantly, when the board, the management committee, and implementation committee is constituted, let's have community members represented at that high decision-making organs. It's really important for communities to take ownership and ensure that their voices are captured. And lastly, on exploration, I think we need to divest. Why can't we put the money that we're going to use to get more oil well and get oil exploration? Why not put it in divestment? Let's invest in clean technology. On PIGB, the time is now, on the electoral bill. The time is now, for electronic transmission. And I'm excited that the National Assembly has heed the voices of citizens, voices of reasoning. And now they've ensured that in the report, they've highlighted and passed that transmission of results would be part of the amendment. But it's important for NCC to immediately invest in ensuring critical infrastructures are provided, particularly at the grassroots, so that communities will not be disenfranchised during the general elections.
Now, let's move from the National Assembly and look at another thorny issue, health, that's COVID-19. Now, what's your research on COVID-19 fund management in the country? Do you think that we are actually hitting the mark?
No, sadly, the pandemic hit us, and it has also affected the fight against corruption. It's really sad and unfortunate that people are actually stealing resources meant to tackle this pandemic. Today, we see that government is not even open to provide how much really have been mobilized and has been disbursed. We wrote a Freedom of Information letter to the Accountant General. At that time, when he responded, he said 35 billion. They've mobilized 35 billion and disbursed 30 billion to various government agencies. They didn't give us breakdown of how much was given to each agency and what agencies benefited from it. And they didn't tell us how they were going to utilize the 5 billion. I'm also aware that the private sector coalition led by Alhaji Aliko Dangote and the CBN governor, the last time we got information from them, they had about 37 billion, and they're hoping to mobilize about 50 to 55 billion. But there's lack of transparency and accountability generally in the management of COVID-19 resources. And we've visited in 15 states various primary healthcare centers. They're actually a death trap to Nigerian people. I can't understand why now that we're talking about vaccine equity, and distribution of vaccines, and yet primary healthcare center who are meant, to house these vaccines and ensure that citizens are able to access vaccines are not being, there's no investment to ensure that they're up to date. In one community, sadly, doctors and midwives actually deliver pregnant women using torchlight at night. They don't have electricity, no access to water, their toilets are in deplorable state. And during a pandemic, so it's really sad that we're not investing in healthcare, but most importantly, there's lack of transparency and accountability. I'm aware that the Economic and Financial Crimes Commission, the Nigerian Financial Intelligence Unit, and the Independent Corrupt Practices and Other Related Offences Commission are investigating some of our claims because we've written a petition and we've made concerns about what's happening and some of the best practices in 7 African countries as we lead COVID-19 transparency and accountability projects in these countries.
Now, with the coming of COVID-19, there was a need for distribution of more palliatives to especially the most vulnerable and poor in the society. So do you think that these palliatives really got to those in need?
It got to them on television, on radio, and on newspaper. But in reality, it didn't get to people at the grassroots. And it's really sad. And we saw, the nationwide looting of warehouses just because corrupt politicians and corrupt individuals warehoused what was meant to be distributed during the lockdown when, goods and services could not transact. And corrupt people kept this, and we're waiting for campaign and electioneering season. We even saw where lawmakers were changing the brand and putting their pictures of on what is meant for the poor people with public resources. So again, we've seen lack of transparency, lack of engagement of even civil society, traditional and religious institutions. At first, government said they were going to use religious and traditional institutions while civil society provides oversight on this distribution. It also tells that there was no mechanism. Who got the contract and how much did they get? What was the where's the procurement document? Where's the contracting document? You know, so today what we've seen in palliative is, you know, grand corruption. And for me, it's really sad because we're dealing with economic, we're dealing with humanitarian, we're dealing with health crisis, and here we have corrupt politicians and our representative engage, you know, in grand corruption during this very critical and trying time for our country.
Anti-corruption activist and founder of Follow the Money, a pleasure sharing your thoughts with us, Mr. Hamzat Lawal, on the program.
Thank you, my sister.